The mRNA COVID-19 vaccine is authorized by the FDA under an Emergency Use Authorization, or EUA. The vaccine is not FDA approved, so patients have the right to accept or refuse the COVID-19 vaccine. Currently, there are no FDA-approved alternatives. There are a few things we must go over to ensure everyone has an understanding of that vaccine and its associated benefits and risks.
The benefit to getting the mRNA COVID vaccine is protection against COVID-19. Both Pfizer and Moderna demonstrate approximately 95% efficacy in preventing COVID-19 in adults. This efficacy has been shown to be equal across all races and ethnicities. Both vaccines are a 2-dose series, and it is only after receiving the second dose of the vaccine that you receive the benefit. This benefit occurs about 1 week after receiving your second dose.
Vaccines work by building an immune response and creating antibodies. Therefore, if you come in contact with the virus later on, your body will recognize it and be able to fight off the infection. Your body has to use a lot of energy in order to build an immune response, so you may notice some adverse effects after receiving a vaccine.
Some known adverse events include pain, swelling, and/or redness at the injection site, fatigue, muscle or joint pain, headache, fever, and nausea and vomiting. These may occur in 1 to 3 days after vaccination.
Most symptoms are mild and get better within 1 day. You can take either acetaminophen, Tylenol, or ibuprofen, Advil, to reduce the severity of symptoms post-vaccination unless your doctor suggests otherwise.
If you were to experience a serious adverse reaction, please seek emergency medical care through the emergency medical response.
A rare side effect of the vaccine that may occur is a delayed response in the form of a rash and itching around the injection site starting around 7 to 8 days after receiving the vaccine.
If this occurs, you may apply hydrocortisone cream around the affected area. If the rash persists over 3 to 5 days, contact your primary care provider.
Adverse reactions are more common after the second dose. Patients who have had COVID-19 previously have reported symptoms after the first and second dose.
Some unknown adverse events are possible as this vaccine is being given under EUA. Please report any adverse events to the vSafe app, a CDC-supported platform.
After the vaccine has been administered, please remain in the observation area for 15 minutes.
If you have experienced a serious reaction to a vaccine in the past, please let the immunizer know, as you will need to stay in the observation area for 30 minutes. You will need to return for a second dose at 21 days or 3 weeks for the Pfizer vaccine and 28 days or 4 weeks for the Moderna vaccine after the first dose.
If you happen to test positive for COVID in between your first and second dose of the COVID vaccine, please inform your provider. You may receive your second dose if you are no longer in quarantine and you are symptom-free, with the exception of loss of smell and/or taste, which may persist.
The individual administering your vaccine will review any questions you may have with the mRNA COVID vaccine and consent you to receive the dose.
The final question we have for you is, do we have your consent to administer the COVID-19 vaccine today?